Our loving Heavenly Father, thank you for this beautiful day, Lord. Thank you for giving us one more day to live a meaningful life. Lord, as we come together as a family to listen to scientific and interesting matter, Lord, we pray for your wisdom. We pray for your presence so that we can focus, we can listen, and we can grow. Bless the speaker, bless the moderator, bless this session. Help each listener to learn. In Jesus' name we pray. Amen. Please be seated. To introduce our speaker for the day, we have our moderator, who is none other than our own Associate Professor of Ophthalmology, Dr. Leena Mariyam Varghese. So welcoming her to introduce the speaker.
Good morning all. I'm standing here to invite a wonderful innovator and inventor in the field of ophthalmology, Dr. John Davis Akkara. He did his MBBS and MS ophthalmology from Bcmch, Pondicherry. He did his Glaucoma fellowship from Aravind Eye Hospital, Cataract fellowship from Westend, Chennai. He is a glaucoma, cataract and refractive surgeon. He works in Chaithanya Eye Hospital, Kochi, and he has a hospital of his own, Westend Eye Hospital in Kochi. So we, on behalf of Believers family, would like to invite you, sir, and we are waiting to listen to your wonderful talk.
Thank you so much for the kind introduction. I would like to thank the Believers family, each and every one of you, for inviting me for this talk. Special thanks to Dr. Joshua, because we accidentally met on a train and got around to talking about innovations and all these things, and he invited me for this talk just out of the blue. So thank you everyone for this invitation. So the topic of today, I'll be covering two topics. One is artificial intelligence in ophthalmology and one is 3D printing. So among you, how many of you know about artificial intelligence? Just a show of hands. Okay. By the end of this, I want all of you to be able to make your own AI for free. You can actually make your own AI algorithm and also learn 3D printing. You can make your own 3D designs and 3D print. We were just looking where is the nearest 3D printing place available. There is one 30 kilometers away in Kochi. There might be others nearby, but it's available here. So on to the topic. So what is this? I'm just going to put a financial disclosure. I was working with an AI company, Lebancare, and I have a few projects running. But none of these are going to be financially going to be affecting this talk. AI, is it fiction? No, it's already there in everything which we are using. So this is actually what is AI. All these spam filters, all the Alexa, Siri, Google, all of these are AI. But how does it apply to the medical field? We'll have to see what all AI can do. In the past few years, that is recent few years, if you see, there's a lot of publications on AI. It's just skyrocketing at this point. 2018, 2019, 2020, COVID struck. Everybody started using a lot of AI and publishing all their work. So there's a lot of work on AI being done now. And if you look at what the definitions are, you just have to know that AI is the simulation of intelligence in computers. So computers, as traditionally programmed, it was just instructions. You will tell the computer, get input, if this, then that, else that, then next step. You have to program each step. Intelligence means you make the computer able to think for itself what to do. Not exactly, but it simulates that. And machine learning is exactly learning by itself. So this is probably a misnomer. This is how humans learn. So instead of machine learning, it will be similar to human learning. How babies learn, that is how machine learning works. And all these deep learning, artificial neural networks, it is how the brain works, how the neurons work. We are trying to simulate that in computers. So the human body is the best AI device ever. And where are we now? We are in the fourth industrial revolution. First was the steam engines and all that. Then the mass production in the second industrial revolution. Third was computers. Fourth is cyber physical systems, which include AI, 3D printing, virtual reality, all the latest technologies. And this is just a timeline of things, not important because this timeline is ever increasing at a very rapid pace, starting from Blaise Pascal. Now this is only 2018, but now we have ChatGPT and so many other AI things available. So this is going to improve the accuracy and quality of medical care. That is why doctors and the medical field is interested in this. Improve the quality and the accuracy of medical care. If you look at ophthalmology, that is not the only thing which uses AI. You have AI in many departments. I'll just go through a few of these things. And why AI? Because it is faster. It is less expensive. It is scalable. Once you build an AI for something, you can expand it to cover many other things very easily. And AI is very portable. It can be put on a phone also. And if there is a shortage of staff, we can definitely help out with AI. And AI does not need rest. AI does not get bored of repetitive tasks. So because of that, AI is here to stay. So if we look at radiology, there are several algorithms. One interesting algorithm was something that predicted whether a CT scan showed COVID symptoms or not. This was done during COVID. They just took all the CT scans, decided that, okay, we don't have a proper test for doing everything. Let's do it with AI. But not only CT scan, they were able to do it with X-rays also. With X-rays, they were able to predict with a certain percentage of accuracy whether the patient had COVID or not. And this is dermatology. There are several apps which will tell you whether a lesion looks, nevus looks malignant or not. So these are apps available on the Play Store, App Store. And there are several users in pediatrics, in pathology, oncology. Every department has this. So if you want to start some projects on AI, all the material is there. You can just start using some of the existing algorithms, or you can start creating new algorithms by the method I show you. Cardiology, obstetrics, gynecology, and all the big companies, Google, Microsoft, Meta, Facebook Meta, everybody has their hands in AI. You know that they are all right now interested in large language models, ChatGPT and all this. Why ophthalmology in particular has a lot of AI? Because lots of image data, lots of big data. Big data means just a lot of numbers and data, because we have lots of machines, starting from slit lamp microscope, fundus photographs, OCT, fluorescent angiography, anterior segment OCT. So many machines are there. All these machines generate a lot of data. This data is what powers AI, and this is why AI is required. When there is a lot of data, to gather the information from that, we need help of AI. So it's there in the news also. Even an 11-year-old girl developed AI app to detect eye diseases, and that had 70% accuracy. So many things are there in the news. So these things are easily available even to 11-year-old children. So there is no reason why we should not be behind. Ophthalmology, there are several diseases where AI is used, starting from diabetic retinopathy in glaucoma, and ARMD, ROP, retinal vascular occlusions, keratoconus, cataract, and all these things. I'll just go into what is there in all these quickly. And of course, there are some more. Calculating the IOL powers, planning of surgeries, planning of intravitreal injections. So all these things are some, we don't actually know how many intravitreal injections a patient will need. This will help you to plan when and how many times a patient will need injections based on their scanning data, OCT scans and other data. So there's an article which we published in the Kerala Journal of Ophthalmology. It just covers some basics of AI. Diabetic retinopathy, there is an FDA approved algorithm. The US FDA has approved an AI algorithm to diagnose diabetic retinopathy from the fundus camera. So that is there. In India, we have Medio's AI, which they actually have made it offline AI. Usually most AIs, they require a very powerful server. So what they usually do, take a fundus photograph, send it to the server analyzes, sends back the information. Medios has done it on an iPhone. So now it has been made simple enough that even a relatively high-end iPhone can handle that. And there are several other players also. These are some of the fundus cameras which have built-in AI. This is the AI report which shows the diabetic retinopathy changes. And this is a website where ophthalmologists can log in and freely use their AI. You can just create an account, put the retina images, do an AI. This can be used for an AI project. If you want to start a study, you can use this to start a study. And glaucoma, OCT is the OCT scanning, and in the OCT scanning, all these things are done with AI. And there is a Sensimed triggerfish. It's a newer IOP measuring device. It's a contact lens. So that lens data uses stress and strain data. That is converted into IOP using, again, AI. So this is a continuous intraocular pressure measuring device. So all these newer devices, they use AI. And this is measuring of cupping. This is a simple project by engineering students to measure the cup disc ratio. Many engineering students use AI in medical field as their topic. So glaucoma, this is a visual field test, and AI can be used to detect pre-perimetric glaucoma. Pre-perimetric glaucoma means glaucoma which cannot be seen on perimetry. Perimetry is visual fields. So whatever glaucoma cannot be seen on the visual fields can be diagnosed by the AI by looking at the visual fields itself. So that much powerful AI algorithms are there. And of course, you can detect the different types of field effects, and you can detect progression. What is more interesting is they can predict the future. So after feeding in 32,000 visual field data, they were able to predict what will happen to the visual fields of a person in the next 5 years by using this AI algorithm with the IOP, the intraocular pressure of the person. So that will help in planning the treatment. You can tell the patient, if we control the pressure to this level, this is what is going to happen in the next 5 years. So that is very useful. Retinopathy of prematurity also. There's a lot of AI being used in the analysis. These are some of the softwares being used. Age-related macular degeneration also. I am going fast through this because this may not be of interest to most of you. This is pure hardcore ophthalmology. But this is an app available on the Play Store. Play Store, download the app. It's an AI app. You can use it to scan the OCT images. And retinal vascular occlusions, different occlusions can be diagnosed. OCT can be analyzed with AI. You can analyze other retinal diseases such as PEDs and all sort of detachments. Keratoconus, disease of the cornea. It is notoriously difficult to identify if it is, whether it is increasing, whether it's going to stay stable. AI will help in diagnosing whether the keratoconus is going to increase or not. And several other corneal diseases can be diagnosed with AI. Cataract, very easily from photographs, and the grading of the cataract can also be done by AI. And pediatric ophthalmology, from social media photographs, AI can detect whether there is leukocoria, that is white reflex in the eye. And if such a thing is there, that baby has to go in for eye screening. So this is just a normal photograph, not a medical photograph. AI can detect cataract or other retinoblastoma, other diseases of the babies by using the algorithms. Okay, and then ocular oncology, there are some lesions which affect the conjunctiva, some cancers. So if it has to be cut, this will be able to look at the biopsy specimens and tell the margins. So that is going to be sort of intraoperative marking of the cancerous margins. It can predict refractive error progression. So you can just predict, okay, this patient has myopia, short sight. Is the power going to increase? How much it is going to increase? You can predict all that with a lot of data from their age, gender, onset, the current refractive error, visual acuity, the retina photographs, all these things. It's able to predict. Also, they use their height, weight, and other parameters. So that is going to be very useful. And even more, you can actually detect cognitive impairment from retinal photographs, dementia, Alzheimer's disease, stroke risk. That is, in the next 5 years, what is the risk of a person developing stroke? What is the risk of a person developing a heart attack? By looking at their retina. No ophthalmologist will be able to tell you that. So this is Google's health division study, Google Verily Sciences. So they have shown that they were able to predict the age of a person by looking at the retina, the gender of a person by looking at the retina, which I am sure no ophthalmologist knows how to do. It's able to tell whether the retina is from a male patient or female patient, and smoking status, whether HbA1c status. So they predicted HbA1c of 6.7. So all these things can be predicted by looking at the retina. So the eyes are really the window to the soul. Alzheimer's. So Alzheimer's from retinal photographs as well as OCT images, they were able to predict the chance of a person having Alzheimer's or developing Alzheimer's, and many other neurological diseases also, because all these neurological diseases, though they affect the brain, the eye is actually an extension of the brain. The retinal nerve fibers are actually directly from the brain. So that is why you can have these changes there also. And then this is a different tangent. Apps for low vision patients. So many apps which many patients who have low vision, who cannot be improved with surgery or medication, they can use these apps. All these apps use AI to recognize text, recognize things around. So these are very interesting apps. Microsoft Seeing AI, ID, and all these money readers. So if a person is very blind, like low vision, they can use these apps to get around. So this is an app which it narrates the world. Like if you take a photograph, it will tell you what is there. So a blind person will find it very useful. These are other things which will again help blind people. So these are all apps. There are Indian apps also. This one was from Arvind Eye Hospital by my friend Dr. Chaithanya. So all these apps are available. And Be My Eyes is a very interesting app. This is not AI. This is an app in which those who are having low vision or blind can ask for help, and it will come to volunteers. So if you install this app as a volunteer, you might get a sudden call telling that a person needs help, and then the person will send you a photograph or show a video of something and ask you, can you help me with this? So that sort of social app is also there. Then Iris Vision Voice also help in blind people to look at things by enhancing the contrast. The voice converts it to into audio feedback. So these are several AI devices available. Orcam is a device which incorporates all of these. There are some devices from India as well. So AI is here to stay. AI is writing articles also. So if you are writing any article, if you are writing a leave letter, if you are writing any sort of letter, you can just ask ChatGPT or Microsoft's Copilot or so many other, Llama from Meta. All of these will write the articles, write the letters for you. So be very careful. Your answer papers may be written by AI if you're not careful. So AI is a co-author in many articles, but then later it was decided that it is not allowed to represent AI as an author, so that was removed by many journals. Can we trust ChatGPT? Absolutely not, because it has hallucinations. AI can give you wrong information. Never trust AI completely. You just use it to help you out. So that is what I'll have to tell you. ChatGPT, you can use a free version very easily. I asked, can you write on treatment of cataract with chloroquine eye drops? Absolutely. It wrote an article. I asked, can you give citations? Absolutely. It gave citations. So citations are fake. Okay, this one didn't give, but previously when I asked, it gave fake citations also. Okay, I asked it to rewrite with citations. So it does that. After this, it gave with fake citations. Whatever you want to prove, it will prove. So don't trust AI. And it can be abused, not only for text, also for images. These are not real retinal photographs. These are fake retinal photographs. So these are enhanced retinal photographs. These are not completely fake. These are enhanced. Okay, these are enhanced. Yeah, might have seen in all these, CIA things. No, they'll say enhance image, enhance image. That can be done. AI will enhance image. AI can generate images also. So by all these are Adobe Firefly, FreePic, Stable Diffusion, Bing. All these have image generators. Google also has Gemini. Gemini also generates images. These are fake images. These are not real retinas. These are fake retinas. And you don't know the difference. And not only normal retinas, it can fake abnormal retinas also. Okay, so we have to be careful about where it is being used. So these are all the articles showing you how you can fake this thing. And this is how to make your own AI. This is a video. Somebody wants to go through it. This is an 8-minute video. You can scan this QR code. You'll get the video. You can take a photograph or scan it later. And it will teach you how to use a standard image model, put some images, like different categories. You can say diabetic retinopathy, glaucoma, ARMD, and in each of these categories, you put some images of that type. Some means if you put more images, it becomes more accurate. So if you have 1,000 images, it will be very accurate. But even with 10 images, you can make an AI. Okay. Or as simple as you want to differentiate between a dog and a cat. Put pictures of the dog, put pictures of the cat in different categories. Make it train. So here, train the model, and you'll generate an AI. That AI you can use to differentiate. So this video will help you with that. I'm not playing that video, but we'll go on to 3D printing because this is another topic which I want to cover. So 3D printing, how many of you know about 3D printing? Okay, a few people. So the concept of 3D printing is to make physical things from a 3D design. Okay, again, financial interest. I have made some few designs, but most of them are free, open source. This one is available on Thingiverse. That is a website where you can share 3D designs. That is there on the National Institute of Health 3D Exchange website. That is the US National Institute of Health that allows you to share medical 3D images. Okay, and you can print those things. You can use that in your PowerPoint as well. I'll show you that. Process of 3D printing is make a design, that is draw a 3D model, and use that 3D model in a slicer software. That's just another software which will convert it into instructions for the 3D printer. If you are doing it for just animation, you can just directly use a 3D design in animation. If you want to print it, it goes to a slicer software, and then the 3D printer physically creates that physical object, and then there is some processing involved. You might have to brush it with acetone, you might have to give UV light, all those things to finish the product. These are the materials. Most commonly used is PLA, ABS, and different type of printer uses resin. But you can also print with titanium, stainless steel, and all these things. And PETG is also there. It's a flexible material which can be used. And most commonly available printers would be FDM printers. The cheapest FDM printers is around 12,000 to 15,000, 15,000, not dollars, rupees. Okay. So if you want to start 3D printing, you can buy your own printer, or you can go to a 3D printing shop and ask them to print it, because setting it up and learning printing is a little difficult. And yeah, so these are the different things, types of things available. Ophthalmology, from cornea, lens, retina to implants, surgical planning, everything has uses of 3D printing. This is another article which we had put on 3D printing in ophthalmology. I'll quickly go through this video. MIGS is a minimally invasive glaucoma surgery. Okay, so for that, there are some instruments which are used, some implants which are used. I'll just play from here. Oh, sorry. I just skipped to that part. Yeah.
The Kahook dual blade glide, KDB glide, and it can be rotated in 3D in virtual reality to show all the parts of it.
So this was designed by me very easily with basic
can
tools.
Be implanted into a virtual
this was not
eye,
by me, but this is an image you can download for free.
Surgeries.
3D image you can download and put it in your PowerPoint presentation.
This is a Solex gold shunt which is placed in the suprachoroidal space.
This can be easily drawn and printed.
In a virtual suprachoroidal space by using the
this
3D
can be
model.
used in your PowerPoints.
The 3D MIGS models which we have made have been uploaded to thingiverse.com/drjonda/design.
So this is where you can download the 3D prints. And this is just mine. There are several 3D designs available which you can download. And you can be used for dry lab, that is practicing surgical. So any department, anywhere, if you have some simulation required, some training required, you can use 3D printing to make the designs. And the material cost is going to be very less. 3D printer will cost maybe 20,000. Material will cost maybe 200, 300 rupees. So this is for practicing lasers, practicing surgeries. All these can be done with 3D printed models. And these are some commercially available 3D printed models for eye surgery training. And these are some other things which this is something which my friend in Arvind made. This is very easy to do. Just draw the 3D design, 3D print it. And this transparent part was difficult to do in 3D printing, so that we used an acrylic mold. But after that, was able to do cataract surgery training with the 3D model. So that is something which we can easily do. Okay, I'll just show you the 3D models being used in PowerPoint. So this is a valve. This is a glaucoma drainage device. It's an Orolab aqueous drainage implant. This is a B-hex pupil expander ring. Okay, I put these models in this PowerPoint presentation so that it will move like this. So you can put it on one slide, put it on the other slide. You can make it rotate in 3D just by using the morph transition. So if anybody wants to put 3D models in their PowerPoint, use 3D models, put it one slide, put it on the other slide, change the position, put morph transition. It will do this. Okay. Yeah. This is a project by MBBS students. MBBS third year students came to ophthalmology posting. They said, sir, we want to do some project. I said, okay, you Google search and find out something we can do. They found that there's something called punctal plug. I said, okay, let's 3D print it. They designed it. I told them this is what a punctal plug looks like. And they sat and designed the 3D model. We printed it, published it. So this is what can be done. This is a glaucoma drainage device. These are a few glaucoma drainage devices which we use for surgical training. So surgical training, we won't get all the expensive implants. You can practice with the 3D printed implants. Actually implanting in the eye, not possible with this material, but you can at least do in the wet lab. But you can also design new designs. If you have an idea for a new instrument or a new implant, you can do prototypes. Once you have the final prototype, you ironed out all the problems, you can go to the company and tell, you can actually patent it first, and then go to the company and tell, I have a design, I have a patent, I want to manufacture this. Then that can be implanted or used in surgery. Surgical instruments are designed like that. So teaching tools this is for contact lens fitting practice. These are for anatomy. This is also my friend Dr. Prasanna. He has designed this in 3D, augmented reality, as well as designed and printed it also. These are 3D models. This is the printed one. Previous page was the virtual model. Yeah, this is the printed. No, this is the virtual model. That's why it's floating in the air. And orbital parts, practicing dissection can also be done. Many types of surgical training can be done with these 3D printed parts. CT scans, you can just generate the 3D and print it. The radiology department can generate the 3D output from that. Even OCTs can be 3D printed if you want to show the patient what it looks like. Surgical instruments can be designed like this. Earlier it was all done on paper. Now it can do it on the computer, design it and print it. This is a fundus camera, smartphone fundus camera which I designed. Again done using 3D printing during COVID times. It's a smartphone with a lens which can take fundus photographs, okay? So that is there. Smartphone adapters for microscopes. Smartphone imaging of the eye. This is a trocar cannula for vitreoretinal surgery. This is an instrument designed in 3D printing, tested, and then final one done in metal later by the companies. So that is, and this is another one. This is a pupil expander ring. First few designs were designed in 3D printing, tested. So final design was done. It was manufactured by companies in the implantable material. So biocompatible materials cannot be easily 3D printed, but you can definitely test it out. Fractures, if you want to have reconstructive surgeries, you want to customize it to the patient's fracture and the anatomy, you have 3D printers printed from the CT scans. Orbital implants. So when children are growing, the implant size also has to increase and it has to fit that particular child. So you have to have the correct size and shape. And these are all the things which are available in 3D printing. I have a video, but I have a video. I'll just show you a video on 3D printing. Oh no, this one I showed you, I think. I'll show you a different one.
Open source printed surgical instruments demonstrated in virtual and physical reality. Complex eye surgeries.
I'll just quickly go through so that I can show you. This is
fixed a bow tie in a plastic container.
This is the surgical practice with the 3D printed valve. Okay, so this is a goat tie which is regularly used for surgery practice, and this is how the surgery practice can be done. Since everybody are medical field, I hope you are not squeamish by this.
By suturing through the 4 holes,
so that can be done.
Is the first GDD that
And you can also have
uses of 3D printing in ophthalmology. There are by Dr. Pavan and eye drop.
This is an eye drop helper. So to put the eye drops in the eye, Dr. Shivagami and Dr. Annamalai, they designed a device which will fit the eye drop bottle and it can be used by the patient to drop the medicine directly into the eye correctly. So that was one thing.
Shivagami. Surgical planning by using the 3D prints.
Yeah, then surgical planning and other things. And then rest of it, I think we have already seen. Yeah, this is how you search for 3D printing places. You just go to Google Maps, search for 3D printing near me or 3D printing in Tiruvalla if you want. And you can just find all these places and you can just ask them, I want to take some prints. Shall I email it to you? You can do that. You can email it to them. They'll print it and give it to you. So thank you for listening. Any questions?
Thank you, Dr. John, for taking us into that whole new world of artificial intelligence and 3D printing. Does anyone have any doubts? We have our Ophthalmology PGs here.
So I have a question for the Ophthalmology PGs. Who is going to do the project on AI? Who is going to do on 3D printing? She.
PGs,
Okay.
please stand
You're
up.
going to do, no? Okay.
So, stand up. No? So we have, these are our PGs here.
No, she's just pointing that she's going to do. Okay, so all these things are easily available. There's not much cost involved. You can actually do it as a simple project. You can do the 3D designing for free, or you can, get the help of some engineer to do the 3D designs. You have an idea for some, the eye drop helper was just like that. Patients were putting the eye drops all over the face. They were just squeezing the bottle, wasting the eye drops. So my friend said, okay, we should do something, and we just designed it. And so many other small ideas will be there. These things, 3D printing, AI, apps, all these things can make those ideas into something useful. And those are projects which can be easily done during your post-graduation. Questions? Anybody from other departments also want to?
Thank you, John, for that wonderful talk, and I'm glad that I met you serendipitously on train, and only to identify the inventor and the visionary in you. So it was really an eye-opener. And gleaning from your talk, is it possible that all departments can do path-breaking research work with 3D printing and artificial intelligence? Is that what you meant by your earlier slides when you said anatomy and physiology and all those departments you had shared in your first few slides?
Absolutely. So everybody will have their ideas on how you can use these, fourth this thing, that is 3D printing, AI, apps, virtual reality. All these things can be utilized by each person with their own difficulties and all that. So you will know what is going to help you. So from ophthalmology perspective, these are the things which are available. These are some of the things which me and my friends have also done. But from maybe some other department's perspective, and even maybe not even medical, you might have some minor difficulties, inconveniences, which you have some ideas for. That can be sorted out using these things.
Dr. John, you told us that there are certain materials. So we tell the 3D printing people what material we want?
So PLA is the easiest material to 3D print. That will print very easily without many defects. So printing can have defects also. So maybe if the temperature is not right, if the material has too much moisture, it might print in a defective way. PLA is the easiest material to print, but it is not very strong. So if you are doing some simple prototypes, you want to just make a eye drop helper or something of that sort, use PLA, good enough. If you want something strong, go for ABS. If you want something flexible, there are some flexible materials. I think PETG is one of them. You just ask the 3D printer, I want a flexible material, they will take that. So PLA is the first material which you would want to use. Also, there is another type of 3D printing called resin 3D printing. If you want something with high resolution, fine instruments or something, you will have to go for resin. So these are the main 4 materials you need to know about.
Those glaucoma drainage devices?
That was in resin. So that has minute holes here and there, different structures that needed resin to print accurately.
What was the cost?
Cost of the material was probably 200 rupees.
So
or less.
So the whole 3D printing will cost you around?
So I happened to be in a medical college where the dental department had 3D printers. So I had 0 cost for the printer as well as the material, because they said anyway printer is sitting here, you use it, and I was able to use it. So a cost of 1 liter of that. 1 liter is quite a lot. Of that material was around 2000 rupees. We used some milliliters. But that resin printer needs some more expertise. The PLA printer, you can print it, you can start with a PLA printer very easily. You don't need to handle it with UV light and alcohol and all. You have to use more finishing touches on the resin printers. So if you use a PLA printer, cost of printer 15,000 to 20,000, 1 kilogram of material 900 rupees. That is the cost. But if you go to a printing shop, maybe they will charge you 1,000 rupees if you want to print my foldable fundus camera. It cost 900 rupees to print. This big size, handheld size.
Thank you, Dr. John.
Are there any questions? If not, we'll wrap the session. I have Dr. John's contact with me. He's a very helpful person, and I'm very sure, Dr. John, that you would love to guide our students, both undergraduate and postgraduate, if they would be interested in any research pertaining to this.
I just want to reiterate that punctal plug project was done by MBBS students. Okay, not even Ophthalm PGs. Ophthalm PGs were too busy, as you can see. But the MBBS students, some of them were very interested. So they actually came and asked, can we do a project? We want to go for USMLE and they want to show something on our CV. Absolutely, let's do a project. And Ophthalm PGs, they didn't do any 3D printing projects, but they had their thesis and other work. So if you do have time, this is something you can do.
Would you collaborate with other departments also?
Absolutely, definitely. So I collaborated with the dental department there because they were already doing some 3D printing. So you just talk to the other departments, find out what is required. And like that, you can do many things here itself. I'll definitely be open to collaboration with other departments as well.
So thank you. Thank you so much. So that is Dr. John Davis Akkara, inventor and ophthalmologist, young and dynamic for us. Thank you, Dr. John, for coming over. It was a great pleasure to have you. We have people presenting on other people's work, but today we had somebody presenting on his own work, and that benchmarks things to a whole new level. Thank you so much. So thank you all for coming. Have a wonderful day.